Hi, this is Attorney Gordon Johnson. I now want to talk about some of the objectives of neurosurgery or brain surgery. As we talked about in our previous video, the single biggest thing that typically is a risk factor after severe brain injury is the increase in intracranial pressure that comes from the flow of blood into the brain without it being properly drained out of the brain, or as a result of a bruise which creates swelling, much like your ankle might swell up. The objectives of neurosurgery are really twofold. One would be to go in and actually fix a bleed, go in and repair the blood vessel that's bleeding, or two, to do something that will reduce the intracranial pressure or give that swelling and that phenomena that's causing the intracranial pressure someplace to go. Anytime they do brain surgery, they obviously have to find a way inside the skull, and they will typically do that by removing some type of a bone flap. It wouldn't be as big as taking off the top of the skull like I just did here, but they might make a flap perhaps as big as a quarter of this top half in my hand, and they do that by making drill holes, like you might in a woodworking shop, drill holes, and then taking a little saw and connecting those holes and removing the flap. Now, if they take the flap out, go and do the surgery and put the flap back, that's typically called a craniotomy. If they go in and leave the flap off for an extended period of time, able to give the swelling someplace to go, to allow the brain to expand into an area that isn't compressed by the skull, that might be called craniectomy. And a craniectomy is where they actually leave the bone flap off for a substantial period of time. As you can see, if it was as dramatic as the entire top, you would have the brain having lots of room to expand and allowing it more room. But they don't take that much off, they take off enough to reduce the pressure. Now, the other thing they may do is put in a drain to drain off some of the excess fluids. They would typically call that a shunt, and that drain will go off someplace else in the body where the amount of fluid isn't as critical as it would be inside the brain.